Approximately 20% of all women suffer with chronic pelvic pain. It might affect their ability to go to school, it might affect their ability to go to work, or to enjoy sexual intimacy with their partner. It's been my experience that oftentimes patients suffer in silence. They don't want to tell anyone of their problems. It's been my experience that oftentimes patients who do complain of pelvic pain to their physicians oftentimes end up having surgeries done to try to cure their pelvic pain. Oftentimes those surgeries involve multiple laparoscopies, hysterectomies, and sometimes the removal of the ovaries and tubes. Unfortunately, those surgeries don't help chronic pelvic pain in many circumstances. It was actually the frustration of dealing with pelvic pain that made me get more involved in helping understand the cause of pelvic pain. I was lucky enough to participate in a think tank. There was approximately 10 subspecialists that dealt with patients with chronic pain, and the 10 of us got together in 1995 and discussed our own personal experiences with pain and what was causing it and how to best treat it. That turned into the International Pelvic Pain Society. I, in fact, am a past president, one of the founding members of that society, and I encourage you to go to the website pelvicpain.org. I think you'll find a wealth of information there, as my understanding of what causes and how to treat pelvic pain has evolved. I also have been lucky enough to teach many courses to other physicians on the management and evaluation of chronic pelvic pain. I have taught courses both for the International Pelvic Pain Society as well as for approximately 10 years in a row. I was the moderator for the postgraduate program at the American College of OB/GYN's annual meeting. Our understanding of chronic pelvic pain has advanced over the years. The important concept for you to understand is our management of acute pain, such as the pain from an appendicitis or a ruptured ovarian cyst, is totally different than our evaluation and management of a patient with chronic pain. It might start with an individual problem, let's say endometriosis, and that endometriosis might cause a person to have severe menstrual cramps. But when that goes on month after month after month, the nerves that actually involve the pelvis become hypersensitive. There's reflexes that occur not only in the tissues in the pelvic area, but also within the spinal cord. We refer to this as upregulation. That central sensitization makes the nerves hypersensitive, but most importantly, it triggers a series of events that makes the neighboring organs become uncomfortable and they become new pain generators. That's the important concept that I think every patient who experiences pelvic pain understands. While the problems might just start with a single problem, like severe menstrual cramps, it quickly expands to problems of pain with intercourse, chronic constipation, problems with your bladder, where you feel like you need to urinate frequently or possibly feel like you have a constant bladder infection. These other pain generators need to be identified, and each one needs to be treated. That's what's unique about seeing someone such as myself that specializes in pelvic pain. Our goal, together with you, is we identify each one of your pain generators, and then together, my staff and the providers that I work with will help you overcome each one of those pain generators to turn off the nerve hypersensitivity and those other pain generators that are all contributing to your pain experience. The management of chronic pain oftentimes involves first identifying each one of the pain generators. Then we try to figure out the triggers. What's making your pain worse? Is it, for example, you drink too many sodas? Is it because you're chronically constipated? Is it because you're not sleeping well because you have severe insomnia? Or maybe it's because of the arthritis you have in your low back. So we identify those triggers or those activities in your day-to-day life that might potentiate or perpetuate the problem of pain. By identifying those things, then those become targets for our therapy. I want to help you sleep better. I want to get rid of your constipation. And I might even change your diet slightly to improve those problems. As our understanding of chronic pain has advanced, and as we've already described, there are many pain generators, and there's also many problems outside of the organs themselves. For example, the nerves are hypersensitive. So therapy for chronic pain is typically multimodal. What I mean by that is we are treating each one of those problems. For example, we use medications to calm down those hypersensitive nerves. Those are sometimes referred to as neurolytics. We use physical therapy to try to help relax the muscles with special exercises or massage therapy. And oftentimes you have already figured out that things like heating pad and rest and using a stool softener so you don't get as constipated as you normally are all little things that make a difference. Our goal is that each one of the therapies are attempting to decrease the volume of pain that you have. Once the amount of pain is reduced to a lower level, then you'll find that your life markedly improves. As I mentioned earlier in this video, surgeries are oftentimes done, but unfortunately, they typically fail. The multimodal therapy, on the other hand, has been shown repeatedly in studies to have more success than a surgical approach. There are times when people need surgery, but most of the time we can avoid surgery using this multimodal approach that I described. The area of chronic pelvic pain has advanced as our understanding of what causes that pain has also advanced. At this point in my career, I'm actually using Botox to actually turn off nerves and relax muscles, and I use a lot of neuromodulation, which is where we're using electricity to actually stimulate those nerves that are so hypersensitive. And in fact, there's low-level lasers that are being used on a regular basis in sports medicine that we will start to apply to some of the chronic pelvic pain disorders that my patients and you commonly suffer with. My final message I want to give about the management of chronic pain is that while we give you the tools, the medications, it's a team approach that makes you better. You, my staff, the physical therapist, we all work together. And the things that you initiate and work hard to alleviate your pain, and most importantly, the things you maintain in your day-to-day life for the next 20 and 30 years will provide you the long-term resolution of your pain, which is really our goal.